Good morning to all of you who make possible this broadcast. Good morning to Abdiel, who is in the studios, and all our audience tuning in at this hour. We begin the day with favorable results, no fatalities, two confirmed cases, and this reiterates that we have good results that can be consolidated if we abide by the rules. And with this trend, Cuba has 155 patients admitted to its hospitals, 7 in surveillance, 85 are suspects, and the lowest number we have had in the last weeks, 63 confirmed cases. 63 active cases. Our professionals and specialists follow 170 people with different clinical and epidemiological risks in our primary healthcare system. Yesterday, the island's different laboratories studied 2,184 samples in the Pedro Curie Tropical Medicine Institute, 1,125 at the Brother Mejiras Hospital, 319 in Havana's Provincial Center, 281 in Santiago de Cuba, 187 in Villa Claras, 126 in the Genetic Engineering and Biotechnology Center, 94 and the Civil Defense Laboratory, which is back in the network of laboratories working on the detection of SARS-CoV-2, is back, and it processed 52 samples yesterday. And as a result, the study of all the samples, 2 cases tested positive for COVID-19, and our country already accumulates 159,571 samples, and 2,321 people have tested positive, which is 1.5% of all processed samples. The 2 cases confirmed yesterday, the 2 are female patients and they are Cuban. The 2 are confirmed case contacts, and with this, 88.5% of all cases diagnosed with the disease in Cuba have as a source of infection been a confirmed case contact. This remains the group with the most significant risk in our country and the world. We're talking about 2,017 people who have been positive case contacts. There are 101 cases whose source of infection has not yet been determined, and efforts continue to identify their sources of infection. The number of people who have acquired the disease abroad does not change, 161 people, 7.1% of all confirmed cases. As we said earlier, the confirmed cases are female for a cumulative total of 1,152. Female patients have tested positive for the disease, which is 49.6%, and the male sex accumulates 1,169, which is 50.4%. The 2 cases were asymptomatic at the moment of the diagnosis, and there are already 1,256 in the pandemic, which represents 54.1% of all confirmed cases in Cuba. This percentage has seen a growth in the last few weeks, and of the 107 cases in the last 15 days, 86, which is 80.4%, did not show any symptoms at the moment of the test. And this is a trend that is characterizing this disease. One of the patients is from the 20 to 39 age group, and the other is from the 40 to 59 age group. The 2 patients are from Havana, one from Havana del Este and the other from Arroyo Naranjo. And Havana remains at the top with the highest incidence rate of confirmed cases over the last 15 days, with 4.92 per 100,000 inhabitants. However, it continues to reduce its incidence rate. The other province with confirmed cases is Matanzas, which has 2 cases and 0.28 per 100,000 inhabitants, and it has not changed. And the 13 remaining provinces and the Isle of Youth Special Municipality, they already have spent more than 50 days, and some of them even more than a month, and so more than 40 days that they have not reported positive cases. Nonetheless, they continue processing samples. Of the 2,184 samples that were processed yesterday, 627 were from other provinces. And those with the most numbers analyzed were Pinar del Rio with 69, Mayabeque with 75, Matanzas with 154, Cienfuegos with 39, Camagüey with 32, Granma with 50, Santiago de Cuba with 69, and so forth. What I want is to illustrate that the lack of appearance of confirmed cases in these provinces, it doesn't mean that we are stopping the screening and the vigilance, which is most important to be aware of the development of this disease. Much more when one takes into account the behavior of the asymptomatic patients who have the virus and spread the virus. Of the 2,321 patients who have been diagnosed with the disease in Cuba, as I said earlier, we currently have 63 confirmed cases admitted. These are the active cases. This is a favorable indicator. 62, that is 98.4%, having a stable clinical condition today. We always regret the death of 85 people due to the disease. This gives Cuba a lethality of 3.66% versus 4.99%, which is the current lethality of the region of the Americas. With this lethality, the island occupies the 19th place among the countries of the region, and it ranks at the number 95th concerning all countries of the world reporting COVID-19. In the region of the Americas, it has 19 countries with higher lethality, and in the world, 94 countries with higher incidence. The world remains with no control. Last night and this morning, we were reading remarks by Dr. Carissa Etienne, the Director General of the Pan American Health Organization, and she was expressing her alarm and her somber forecast of the behavior of the pandemic and how countries that used to be the hotbeds of the pandemic, like China, Europe, some Asian countries, and how the region of the Americas has become its epicenter with no foreseeable control and no prospects leading to recovery. As of 12 o'clock last night, the same 185 countries continued reporting COVID-19 cases. The number has already reached 9,229,049 confirmed cases. Yesterday, in the world, 165,785 people tested positive for COVID-19. And with yesterday's 5,588 deaths, the world already accumulates 477,269 people who have died for a lethality of 5.17%. The region of the Americas, as I said, has become in the last few weeks in the epidemic's epicenter, and it already accounts for 49.96% of all cases confirmed in the world, after diagnosing yesterday 98,049 cases for a cumulative of 4,610,824 confirmed cases. It already has 230,079 deaths. Yesterday it had 3,634 for a lethality of 4.99%. In the list of the world, the United States leads the countries with the highest incidence and most deaths, with 2,347,022 confirmed cases, and yesterday it had 34,720, and it already has 121,228 deaths. Brazil follows with 1,145,906 confirmed cases, with 39,436 cases yesterday, and it also has a very high number of fatalities with 52,645. Just yesterday, 1,374 people died in Brazil due to COVID-19. And I always highlight this information so that we have an idea of the extent and the complexity of this disease, which has not been the behavior of some of the outbreaks we have had previously of diseases such as dengue fever, Zika, chikungunya, yellow fever, that still has an impact on some countries. These are diseases that are known for several years of evolution, but as a pandemic, the COVID-19 has a magnitude that has not been controlled. And we also have noticed the experience of some of the countries which have de-escalated the measures, and the Cuban television is offering ample coverage of this, the experience of the countries which have lifted the restriction and have not kept several measures. I'm not talking about they do not implement some recovery phases because they need to resume certain activities, but this has to be accomplished with responsibility and the fulfillment of the restriction measures. Yesterday we heard an explanation by Dr. Pedro Mas. He was referring to the term the rebound of the disease, the new waves of cases in countries that had managed to decrease the spread. I'm certain that the Cuban government and the Cuban Party and the Ministry of Public Health are not going to allow this to happen in our country while we enter the first phase, which much of the national territory is already implementing. And this is the information we had on the world and on Cuba to share with you.